Nearly 40% of Americans say they skipped or put off seeking medical care last year due to high costs, according to a new Gallup poll. That's a 12% increase over the previous year amid the highest inflation rate in more than 4 decades.
It would be really great if I could have some sort of help because I can't afford $300 a month just to be able to go see the doctor twice a year. I have to see the doctor. If I want to live, I need medical insurance. I need medical care.
Welcome to On Strike, a production of Workers Strike Back. I'm Kshama Sawant.
And I'm Bia Lacombe. Millions of American working people are going broke on healthcare. In 2021, healthcare spending in the United States reached a record $4.3 trillion, or nearly $13,000 per person. Working people in the United States are forced to pay more money on healthcare than in any other industrialized country, yet Americans are sicker than ever. A Gallup poll from earlier this year found that a record high number of American people put off addressing health concerns because of the cost of care. 38% of Americans said they delayed getting treatment in 2022. That's 12 percentage points higher than the year before. Not surprisingly, women and lower income people are disproportionately affected. The same Gallup poll also found widespread support for Medicare for all, consistent with previous opinion polls, with the majority of Americans wanting the government to ensure healthcare coverage for all. Nearly 3/4 of all Democratic Party voters want a government-run healthcare system.
Yet both the Democratic and Republican parties have blocked Medicare for all. In the Democratic primary election in 2020, when Bernie Sanders' presidential campaign was calling for Medicare for all, Joe Biden famously said he would veto it even if it came to his desk.
It comes to your desk. Do you veto it?
I would veto anything that delays providing the security and the certainty of health care being available now.
It's not just openly pro-corporate Democrats like Biden, though. Self-described progressives like AOC and her fellow squad members and Pramila Jayapal, the chair of the Congressional Progressive Caucus, have spent years giving lip service to Medicare for all while completely refusing to do anything to fight for it. The U.S. has long had worse health outcomes overall than most other industrialized nations, including the highest infant mortality rate and maternal mortality rate, despite having the highest per capita cost for healthcare.
I'm a healthcare provider, so I have to make decisions, for my patients in terms of, prescribing things, plans of treatment for them. And it is heartbreaking and horrible how I have to tell somebody, hey, this is the best thing for your health, but I know you can't afford it, so here's the second best or the third best, or looking my patient in the eye and saying, this medication is ridiculously expensive, but you need it, and so I know this is so painful, but you have to sacrifice other places so that you can live a longer life with your family. It's horrible.
Let's look at life expectancy, another important indicator of the effect of the profit-based health insurance system in the U.S. Countries globally had a decline in life expectancy in 2020 because of the deaths caused by COVID and the disastrous response to the pandemic by pro-corporate political parties. These parties allowed massive pharmaceutical corporations like Pfizer, BioNTech, Moderna, and Sinovac to make an eye-popping $90 billion in profits on COVID vaccines and medicines. What makes these pandemic profits all the more obscene is that they came on the backs of working people. Decades of research by scientists funded by public investment with tens of billions of dollars in grants for development, production, and advanced purchase agreements are what made them possible.
Ordinary people were faced with understaffed, overpacked hospitals, often fatal testing and treatment delays, and shortages of basic medication and equipment for their loved ones. Meanwhile, mega health insurance companies such as United Health Group, Anthem, and Humana saw their profits scandalously soar by billions of dollars. After the worst of COVID, life expectancy started going back up in 2021 in countries such as Sweden, Canada, Australia, or the United Kingdom, countries that have some form of public health care. In stark contrast, life expectancy in the US has kept declining, from 79 years in 2019 to 76 years today. In fact, over the last 3 years, the US has experienced the biggest drop in life expectancy since the 1920s.
All these social safety nets that were put in place during COVID that clearly helped a lot of people are just being taken away. And then everyone is expected to continue to function and to exist at the same level I think the child tax credit helped a lot of families. We see record high costs of daycare and childcare, families being forced to become single income households because they cannot afford childcare otherwise.
The United States is in a health emergency. This isn't inevitable or by accident. This emergency has been created by the utterly dysfunctional nature of the for-profit healthcare system and big pharma. These blood-sucking industries put the profits of millionaire and billionaire executives and shareholders over the health and lives of working class and poor people. Today, nearly 28 million Americans do not have health insurance. For those who do have insurance, it's often completely inadequate when they try to use it.
They make money off of people being like incapacitated. So it's like, why would I help you get healthy if you making money by being sick and dying? Like it's weird. Like it's like the capitalism of it all. It's just like they only think about money. That's like the greedy part of like the economy we live in. It's real. Can I curse? Yeah. It's fucked up. Like it's truly fucked up.
And I know, as a healthcare worker, that I am seeing mostly insured people. I am not seeing all of the uninsured people that don't make it in my door, that can't go to my clinic.
I have Graves' disease personally, which if you don't get it treated is a terminal illness. I currently don't have medical insurance because I make too much, but I can barely afford to pay for housing, everything else that I need. So I have to make sure that I have enough medication to live, which is a very scary thing to do.
Like sometimes people will stay at a job that they hate just because the benefits are great, and that's kind of how like they reel you in. Being unhappy makes you unhealthy, so it should be something that we shouldn't have to worry about.
I broke both my ankles. The first one I broke, I got really good care for, and then the second one I didn't, and now it's like a continuous thing. Like I have like real mobility issues, like lifting heavy stuff upstairs and stuff like that. I just feel like it'll save society in a whole a lot of grief and money if instead of shoveling all of our resources into the pockets of private interests, we kind of utilize those resources for the good of the community itself.
So although we know older people struggle with a little bit more health issues, it's also the teens, the youth right now. We're focusing on like, what can we do to be better for ourselves? And that is health. It's focusing on what we can do and make sure we don't get to the point where we have to reach out for people, or we have to take out loans just to get a checkup.
And what's your ages?
I'm 18. I'm 18 as well.
And I'm only 27 too, so I don't really know much about that, but I feel like I'm doomed from like, I don't know, like I'm doomed.
I see a very small subset of people, and even then is an immense amount of suffering that my patients go through that is absolutely unnecessary.
An investigation this year by ProPublica found that Cigna, one of the biggest health insurers in the US covering over 18 million people, quote, has built a system that allows its doctors to instantly reject a claim on medical grounds without opening the patient file, end quote. Rejecting as many claims as possible is exactly the business model of for-profit insurance, and it means millions of people are being forced to pay out of pocket for costly procedures and medications that their insurance should have covered. So in reality, this parasitic system is driven more by denying healthcare than providing it, because that's where their profits come from.
As a social worker, working directly with children and their families, I see frequently the ways that the healthcare system continues to fail to offer the basic access to medical care that families, adults and children all deserve access to. These are incredibly basic needs that, if you aren't able to go to your yearly checkups, your yearly dental appointments, these can all spiral into much bigger issues that put a greater burden on the individual and also on the system. The for-profit healthcare system, it has a huge hand in continuing these crises and these systemic inequalities that are really impacting families and people across the country.
American people cannot afford this for-profit healthcare system. Working people need free, quality, universal healthcare, and we need it urgently. Medicare for All would eliminate private insurance and create a national guaranteed healthcare plan with no premiums, copays, or deductibles. That should include free doctor's visits, free ambulance services, free dental and vision care, free COVID testing, free child care, free mental health and addiction treatment, free gender-affirming care, and free elder care.
I have so many trans friends before I transitioned that are unable to get basic basic hormones due to still being on their parents' insurance and being afraid of like their parents finding out. Long, massive wait times. I have friends in the UK that it takes several months before they can even get an appointment. It's like very complicated and very ridiculous. And when I was actually having these conversations with people after I was actually transitioning, it was very shocking to me. Not shocking in the way of like, wow, I'm surprised the American healthcare system is bad. I knew that. It was just like, I wish it was easier for other people because the drugs are right there. And that's really all thanks to like my union healthcare.
Such a system, despite being free at the point of use, would in reality be cheaper to run than the current for-profit monstrosity with all its inefficiencies and administrative red tape.
I think sometimes the fear is that it's going to be me getting less money. It's going to be my friends and my family who have to pay more into these services. But this money does exist. It's in the pockets of these giant corporations, in the pockets of the billionaires. If we just if we tax them, if we get this, this money does exist, it is there.
In 2016 and 2020, Bernie Sanders' presidential campaigns energized millions of workers around the demand for health care by putting Medicare for all front and center.
The problem is, at the end of the day, if we want universal health care, if we want to do what every other major country on earth does, this is not a radical idea. We have not had the courage as a people to take on the greed and the corruption of the healthcare industry, the insurance companies and the drug companies. They buy Congress. Alicia, the drug companies and the insurance companies will not buy me.
Joe Biden has never supported Medicare for all, but under pressure from the movement that formed around Bernie's campaign and the popularity of that demand during the 2020 presidential primary, other Democrats scrambled to sound like they supported some version of Medicare for all.
I think that we should have health care for all. I think that the Affordable Care Benefit is better than the Medicare benefit.
Well, you support the Bernie Sanders bill, which essentially gets rid of insurance.
I support Medicare for all, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant.
I want to explain to you why my plan is different. Through my Medicare for All Who Want It plan, everyone will be able to choose an affordable, comprehensive public alternative.
All these people stopped talking about Medicare for all almost immediately after the Democratic establishment succeeded in pushing Bernie out. But in the 3 years since, Bernie and AOC have also all but stopped talking about Medicare for all entirely.
When Joe Biden was nominated, and then the politicians forgot about it. We have not forgotten about it. We still want Medicare for all.
As a healthcare worker, in March of 2020, when the first surge of COVID was just bearing down on us not everywhere across the country yet, but in some of the key like West Coast and East Coast cities, that first surge of COVID was really bearing down on us, March, April of 2020. And Bernie said, I'm out of the race at that time. I was so mad at him for abandoning us. I felt so abandoned by him because once he did that, once he stopped running for president, nobody cared what he said anymore. He wasn't having rallies. He wasn't organizing, traveling across the country. He just went back to being a senator from Vermont. No one cared what Bernie, the senator for Vermont, had to say. They cared what Bernie, the presidential candidate, who was having big rallies and was generating all this support, had to say. There was nobody who had our backs. No one.
On the front page of his website, Bernie has a 30-minute video of a speech to union members, and he doesn't mention Medicare for all or universal health care even once. Social media is the absolute least they could do, but since January of this year, Bernie and AOC combined have only sent 3 tweets that mention Medicare for all. They have never called one rally. They have never once brought Medicare for all to a vote. The last time AOC mentioned Medicare for All on her website was over a year and a half ago.
So we have to ask, what the fuck happened to Medicare for All? The Democratic Party establishment, obviously, was never actually interested in winning Medicare for All.
As you've been seeing, our healthcare system seems to be crumbling underneath this crisis. There is not enough. There's not enough support for the healthcare system. There's not enough support for the American people inside of the healthcare system. Are you now reconsidering your position when it comes to single-payer healthcare?
Single payer will not solve that at all. The thing that is needed is, for example, we have a whole number of hospitals that are being so stretched, including rural hospitals, they're going to need more financing. That doesn't come from a single payer system. That comes from the federal government stepping up and dealing with the concerns that they have.
The Democrats are tied at the hip to the pharmaceutical industry, which profits off of Americans being sick, and the health insurance industry, which profits from denying people treatment and care. Last year, the 8 biggest pharmaceutical companies made $110 billion in profit and paid only $2 billion in American taxes. Meanwhile, they charge sky-high prices for basic needs like insulin and critical medicine for conditions like Alzheimer's. And they've continued to evade responsibility for their role in creating the opioid crisis.
Opioid addiction is something that is a huge crisis and epidemic in this country. Getting people access to treatment and recovery centers and detox centers is like a constant battle. My coworkers and I are like fighting over bed dates for the families that we're working with. We all want the same thing and are just trying to find places for people to go. And this service has been like privatized. And so there's not as much funding that's able to come into it. The treatment centers are very often like very low staffed, very few beds. But when people are ready to get into recovery, they need to be able to go right away. And sometimes there is a pause because someone has to apply for Medicare. Someone has to wait until that insurance is approved. It's such a critical moment for people that can really be a life or death situation.
People like the billionaire Sackler family who peddled OxyContin should be in prison. Instead, they're living large, having won a settlement that grants them immunity from any charges in exchange for $6 billion. Over 645,000 people have died from opioids since 1999 from the crimes of billionaires like the Sacklers. This system is working for these people, not for us. And it's because billionaires like them have long since bought and paid for both major parties. In 2020, Big Pharma gave over $30 million to congressional Democrats. Blue Cross Blue Shield, one of the biggest health insurance companies in the world, gave more than $3.5 million to Democrats in 2020. They gave more to Democrats than they did to Republicans.
Which begs the question, why would the for-profit healthcare industry give all that money to Democrats, many of whom claimed during the primary to support Medicare for All? It's not because they're stupid, it's because Big Pharma and the health insurance industry understand that Nancy Pelosi and Kamala Harris were lying. It's because just like the Republicans, the Democrats are a party of liars and crooks. Big business understands that the Democrats don't actually support Medicare for All. In fact, they know that the Democratic Party will do whatever it takes to defend the profits of the health insurance industry, which means stopping Medicare for All at all costs.
Working in a state like Washington that is a state run by Democrats, moved here sort of thinking it would be this like liberal utopia with access to a lot of resources, but I am running into the same situations and the same barriers and the same lack of access and resources for people that I had anywhere else in this country. And the Democrats are constantly not putting forward legislation that could actually address these issues. They are speaking well and calling out the need to like address these issues, but are not doing anything about it.
But what about Bernie Sanders, AOC, and the squad? They built their campaigns on the demand for Medicare for All. They spent years shouting about it from the rooftops, so why have they gone silent? It's because they don't have any strategy to offer working people to actually win it. Because winning Medicare for All would require challenging Joe Biden. It would require going to war with the Democratic Party and its big donors. It would require using their elected positions to call for mass rallies and actions. It would require them to mobilize ordinary people and rank-and-file union members, battling against many union bureaucrats who refuse to challenge big business. It would require building a new working-class party.
Bernie and AOC are completely unwilling to do any of that. They have decided that maintaining their relationship with Joe Biden and the Democratic establishment is more important.
What was actually needed would have put Bernie and the squad in a position where they would have been public enemy number one within their own party. You know, that's a big pressure for anyone, no matter anyone's good intentions. But I think what was needed was actually an organized movement underneath them, a new party, you know, that would have these people's backs when they went to, you know, toe to toe with basically the whole of the corporate establishment.
In order not to embarrass Joe Biden and to avoid quote unquote relational harm, as AOC put it, they have betrayed working people.
They may have made certain structural gains, but they have also made incredible reputational and relational harm within their caucus. And so if you are trying to get something done within your caucus moving forward, you still need members of your caucus. And that at the core is an element of electoral politics that is simply inescapable.
When AOC says relational harm, she means that she prioritizes her career and comfort. And for that, it requires her to not be a threat to political and Wall Street power brokers. This is the great American sellout. And it's only one of the many abandoned promises due to AOC and others putting their personal interests ahead of the needs of the working class and poor. And this all comes at a price for working people, because many of the millions who were inspired to support, donate, and campaign for these self-described progressives are now considering voting for Trump and other right-wing candidates.
I'm also a teacher. I have, 99% black population, and many of my students who are like 13, 14, I asked them about the Democratic Party. And one of the most things they say is politicians can't be trusted, that they lie and lie and lie. And even some illusions with Trump, they say actually Trump is not that bad because my parents got the stimulus checks. And so I think that's another dangerous development that is happening. The Democratic Party sees black people as really lackeys that will continue to vote for them no matter what they do. And actually that's the opposite of the case, that black working people are looking for a way out of the crisis that they're in, and the Democratic Party is refusing to do so.
When the Democratic Party colluded to defeat Bernie Sanders in the primary in 2020, Bernie had a choice: break with the Democrats and launch a new party that could carry his movement forward, or fall in line with the Democratic Party. Bernie decided to fall in line. That is precisely the moment when Bernie, AOC, and the squad stopped even talking about their own flagship policies. And ever since then, their sellouts have continued to get worse.
In 2021, when the Democrats took office, AOC and the squad held the balance of power in Congress. They had the votes to prevent Nancy Pelosi from becoming Speaker of the House, or to at least extract something out of that process. Activists around the country, including Socialist Alternative and myself, urged AOC and the squad to withhold their votes for Pelosi and use their power in Congress to force a vote on Medicare for all. Instead, they voted for Nancy Pelosi in exchange for nothing. AOC argued that they should, quote-unquote, keep their powder dry and concentrate on fighting for so-called achievable goals like the $15 minimum wage. That bullshit excuse only hung in the air for a few weeks, after which Biden publicly abandoned $15 an hour and AOC again did nothing. Well, here we are, nearly 3 years later, with no $15 minimum wage and no Medicare for all. We've had to watch as the far-right Freedom Caucus in the House has used that same strategy that the squad wouldn't to extract huge concessions from Republican Party leadership. Only instead of winning gains for working people, the Freedom Caucus used their balance of power to carry out massive attacks on social spending for the most vulnerable.
It's really unfortunate that the Republican Party is the ones that are being the disruptors. The Democratic Party is even bragging that, everything runs so smooth in our system. That's not a positive, particularly if you're a progressive and you're just isolated in the party, or you are forced to kind of go along with Nancy Pelosi, like Nancy Pelosi being known as Mama Bear to a lot of progressives. It's ridiculous, and it should be the other way around. The squad should be really paralyzing this government until they deliver what working people need, which is Medicare for all. Instead, now we have the right wing paralyzing the government on a right wing program.
Democrats had 2 years in power with majorities in Congress and control of the White House. They accomplished nothing for working people. Instead, Biden ramped up deportations under Trump's Title 42 law, approved more oil and gas projects than Trump, and blocked the railroad workers' strike. And yet, Bernie endorsed Joe Biden within hours of his announcement that he was running for re-election. So it's not just Biden and Pelosi. Bernie, AOC, and the so-called socialists and progressives in Congress have all refused again and again to push for their own demand. The Democratic Party is a dead end for workers who want to win Medicare for all. A perfect example is the way that Democrats killed Medicare for all in California.
It would have been the first in the nation single-payer universal health care in California. But tonight, Democrats could not unify behind the bill.
California Democrats had a golden opportunity last year to pass a statewide version of Medicare for all called CalCare. Doing so would have provided free health care to nearly 1 in 8 Americans, and it would have provided a huge jolt of momentum for universal health care, inspiring workers and putting massive pressure on the political establishment nationally to act.
And that's precisely why Democrats colluded behind the scenes with big business, the Biden administration, and also some top union leaders to kill the bill.
It would have been a transformative victory for working class people in California. There's a lot of people who still don't have any kind of healthcare coverage in California. There's a lot of people who, have insurance, but it's so expensive that it's like a huge burden for them to actually use it because they have a really high deductible health plan. CalCare would have been a better situation for like pretty much everybody in California. It would have been cheaper. I mean, I'm a union worker. I have very good healthcare insurance, relatively speaking. But I pay several $100s a month to cover my family, and we pay a copay every time we use it. So I would be in a much better situation if I had CalCare, and I have better healthcare than like most people that I know. But when you're part of a political party that is like bought and paid for by the corporations, including the corporations who are making, billions of dollars off of rationing healthcare to the working class people of the state, there's a conflict, and there's just there's no way that the Democratic Party is gonna. They're bought and paid for at this point, and they're getting too much money, and they're too much part of the overall capitalist system to allow something like the threat that Medicare for all in California would represent to let it get passed and enacted. What the history shows is that we would need a much bigger movement with a broader group of powerful organizations to galvanize the kind of movement that would be necessary to actually compel the Democrats to move on this. And maybe actually we need to elect our own representatives who wouldn't be part of the Democratic Party.
In order to prevent it from passing, the Democratic Party establishment in California introduced a watered-down healthcare reform with the intention of sabotaging the original stronger bill. And it worked. It was the sponsor of the legislation, Democratic Assemblymember Ash Kalra, who himself dealt the death blow. At the last minute, he scuttled his own bill and refused to even put it up for a vote, with the excuse that it didn't have the votes to pass.
But in the end, he pulled it. And I think the pressure of, being part of this Democratic Party, establishment was brought to bear on him. And so there was not even an opportunity to see who would vote for it and who would vote against it, and see like the true colors of the Democratic supermajority in the legislature.
And it wasn't just Democratic Party politicians in California who betrayed the movement. The vast majority of top union leaders in California worked either directly with the Democrats to defeat CalCare or stayed silent in the face of this huge betrayal. Some union leaders did stand consistently in favor of CalCare, like the leaders of the Nurses Union, National Nurses United. Unfortunately, these leaders were few and far between.
It wasn't a mistake, it was a betrayal. And SEIU, they represent many different workers and groups of workers in California, but among them are some of like the most exploited workers who are in a union in California. It's just really cynical, honestly, of the union leadership of SEIU to be arguing that we can win something that's smaller and we don't have to fight for this bigger thing. because I think that ultimately they want to preserve their connections with the Democratic Party establishment. And that's why they refuse to support CalCare and instead put their weight behind something that, ultimately was undermining the fight for Medicare for all.
Union members have every reason to win Medicare for all. The majority of union members support it, and healthcare is consistently used as a weapon by bosses against workers in contract negotiations. Every time a contract is up, the first thing that bosses threaten to cut or freeze is workers' healthcare. And when workers go on strike, bosses take away workers' healthcare to try to force us back to work. Establishing free universal healthcare would take healthcare off the table in union negotiations and take away a key weapon that the bosses use to scare workers and try to keep us submissive. The approach taken by California SEIU leaders is unfortunately typical of the majority of top union leaders today who practice what we call business unionism. Those of you who watched our first episode about the important Amazon union drive at KCBG have heard us talk about this before and how that campaign is different. Business union leaders often claim that workers and the bosses have common interests, that what's good for the business is good for the workers. In fact, the interests of workers and bosses are diametrically opposed. Every penny that workers win is taken out of the profits of the bosses, and every penny of extra profit is a penny that isn't going to workers. In order to win anything, workers need to build independent movements and fight for what we need, not what bosses and their political servants are willing to give us.
Part of it has to do with the union leaderships themselves and how they understand the union and how they understand their job within that union, right? If a union leader is making $500,000 a year and their average wage of their members is $60,000 a year, they're kind of not living the same kind of life. They don't have that pressure on them of having to, live paycheck to paycheck, having to worry about how they're going to pay for medications and rent and food and utilities that month, right? God forbid you have a kid with a chronic condition or you have a chronic condition and you can't lose that job and you can't lose those medical benefits, right? So they're lifted up in many, many ways from the actual lifestyle and the problems of the members that they're representing. But it goes beyond that too, and how they understand their job as union leaders, right? Is it to organize the power that their members have at work to fight the boss tooth and nail for what those members need? Or on the other hand, is it just to kind of like talk to the employer and, make a case for, how much they need a raise and go back and forth about whether it should be 5% or 4.5% over 2 years or 3 years and come to some kind of cozy agreement. If they don't see their job as fighting the boss, if they don't see that it's the working class against the billionaire class and that you're on one side or the other, and if you're not on our side, then you're on their side. There's no middle. There's no middle.
This is something that business unionists refuse to understand. Instead of building movements, they cut deals with Democrats to sell out workers, whether it's working with them to kill Medicare for all in California or issuing a historically early endorsement for Joe Biden, despite the fact that he broke a railroad strike. Just over 10 days ago, California Governor Gavin Newsom vetoed a bill that would have banned health plans and disability insurance policies from imposing any out-of-pocket expenses on insulin prescription drugs above $35 for a 30-day supply. That would have included deductibles and copays. A 2019 study found 1 out of 4 U.S. diabetics skipped or reduced doses of insulin due to the high cost of the life-saving drug.
All of this shows why we need a new party for working people. The principal reason why many other industrialized countries have some form of public health care and better health outcomes is because of past labor struggles, and particularly because other countries formed new parties of the working class. Workers Strike Back is getting organized to rebuild a militant labor movement, one that can take on the bosses and the Democratic Party and win. Imagine if the full weight of the labor movement was brought to bear on big business and the political establishment around the demand for Medicare for all. Imagine if the unions, which gave $250 million to the Democratic Party in the 2020 elections, said that they wouldn't give another penny unless Democrats pass Medicare for all. And imagine if union leaders spent that money instead on organizing the unorganized and building a new party of workers that could take on the Democrats and the Republicans. Canada, our neighbor to the north, has a universal healthcare system. In fact, 72 countries around the world provide some form of universal healthcare. It's crucial that workers in the United States know that universal healthcare is possible. Just as importantly, we need to know how universal healthcare was won in Canada, for example, so that we can win it here.
Canada's public health is a source of pride of Canadians. It's probably one of the most important victories working people won in the history of Canada. Canada, like many countries, as the World War II came to an end, people were desperate for change. They remembered the grim years of the Depression and the slaughter of war, and they wanted a better world. We had, by then, a party that was not tied to big business. People in the United States, you have a Democratic Party and a Republican Party, both owned by big business. And we have in Canada two big business parties. A Liberal Party that's a little bit to the left of centre, and a Conservative Party that's a little bit to the right of centre. But we also was built in the 1930s, what we would describe as a workers' party, a party that was independent of big business. That party was called the Cooperative Commonwealth Federation. It was formed by a coalition of farmers, of Labour and socialists, and Labour was a key component from the very beginning. The CCF would book a meeting room, even in the smallest community, and Labour would mobilise people to turn up. And all across Saskatchewan, these meetings took place, including at kitchen tables. They went far and wide and deep into the community. It wasn't left at a superficial, few ads in a newspaper. They built that massive support, obviously based on the experience of the Saskatchewan working class, who had seen their children suffer during the Depression and couldn't afford a doctor. So the CCF was founded in the 1930s. It was far to the left of Bernie Sanders, far to the left of Jeremy Corbyn. And just to give you a flavour of what this party was like, this is the end sentence of the Regina Manifesto, which was adopted in 1933. No CCF government will rest content until it has eradicated capitalism and put into operation the full program of socialized planning, which will lead to the establishment in Canada of the Cooperative Commonwealth. And this was enormously popular. By 1943, the CCF was the most popular party in Canada. In 1944, in Saskatchewan, the CCF won the election, and one of its key promises was public health. Within 2 years, it set up an experimental model public health system in the city. In this system were clinics that were not just doctors, but delivered all range of services, immunization for children, other care, and it was a huge success. It drastically cut infant mortality within a couple of years. And it was so popular that the CCF committed to expand it to all of Canada. The 1960 election in Saskatchewan was fought by the CCF on the promise to bring in universal public health for all people in Saskatchewan, and they won a landslide. Obviously, the doctors in those days and big business and pharma were terrified of this idea. You never know, it might spread to other things. If public ownership and cooperation got going, you never know where it would stop. So in the election, money was poured in to try and defeat the CCF, all to no avail. The CCF was elected, public health was introduced across Saskatchewan. The majority of doctors opposed this, and they stopped working and stopped serving ordinary people. And it's called a strike. The media, big business were all up in arms. But some doctors supported public health, and they set up community clinics, and these sprung up all over Saskatchewan, staffed by doctors who supported public health. And within just over 3 weeks, the doctors' strike had collapsed. the doctors had gone back to work, and public health was introduced. It was so popular that no government of any political stripe has ever dared overturn it. Even the doctors themselves, within a few years, the majority of doctors supported public health. And within a couple of years, it had become universal across all of Canada, a public health system for all Canadians. That's how it was won. It was won by mobilizing, by struggle, by standing firm, by refusing to bend to big business. But I think there's another part to it, and I think this is a significance, is the role of the CCF. Even the most powerful unions have very limited ability to win something for all of society. You know, you can go on strike and you can win agreement from your employer, but really you almost have to use a general strike to force a universal policy, whether it's public education or public health or things like that. And one of the reasons why the United States does not have public health is because the American workers never succeeded in building a political party independent of big business. And I think that's the lesson, is that Canada has a public health system because the Canadian workers built our own party.
Western European nations such as Sweden and the UK also have some form of public health care.
A lot of rights that we might take for granted today was won through mass revolutionary upheaval. You know, I guess Sweden, for many, is known as the welfare state, the strong welfare system. And once upon a time, there was some truth to that. So between 1950 and let's say up to 1980, there were a number of positive reforms that was won through struggle and because of this unique period in capitalism following the Second World War. And so 1 million public housing was built in the 50s and 60s, for example. Free childcare was won with the second women's struggle wave in the 60s and 70s, and also massive improvements in healthcare and the general expansion of the welfare state.
Over the last decade, rank-and-file nurses have been on the front line of fighting for better conditions in healthcare. They see up close every day the horrors of the for-profit healthcare system.
It can be unsafe sometimes when you've been on shift for 12 hours, and in some cases maybe they're short a nurse and you actually have to stay an extra 4 hours and you end up working a 16-hour shift because they can't find someone to relieve you. The goal oftentimes for these hospitals is to try to keep staffing levels as close to the minimum, like the maximum threshold that they can get away with. Because if they have extra staff, then, in their minds, they're losing money. It's like, why are we paying, for an extra nurse so that the nurses can have a lighter patient load when we could just send one of them home and not pay them and make the other nurses work even harder. I've known nurses who have gotten UTIs and stuff because they just didn't stop to take bathroom breaks during their shift. You might have staffing levels that are appropriate, but then an emergency happens, or things change, and now all of a sudden there's kind of there's no safety net, if that makes sense.
The rottenness of the system goes very deep. Our hospitals and nursing homes are dangerously understaffed. Nurses and other healthcare workers are horribly underpaid and deeply exploited, even when they work for so-called nonprofit institutions. Last week, On Strike reported on the courageous nurses' strike at the Robert Wood Johnson University Hospital in New Jersey and the nurses' work stoppage and picket at the Virginia Mason Hospital here in Seattle. Pharmacy workers at more than 300 Walgreens locations across the country also staged walkouts last week over working conditions that they say are putting employees and patients at risk. The workers are not unionized but have been organizing online. Pharmacists are often direct witnesses to the suffering patients undergo, especially with the horrific costs they are forced to pay for necessary medications. Meanwhile, they themselves have been facing chronic and severe understaffing, pushing many to a breaking point. Imagine how powerful it would be if these walkouts, alongside the ongoing nurses' actions and the recent work stoppages of healthcare workers at Kaiser Permanente, all united to demand a Medicare for all system.
The scale of the problem and the scale of the solutions that are needed Makes it all the more shameful that Bernie and AOC have thrown out even the most basic demand of Medicare for all, and led the working people who supported them into a dead end. This is what we mean when we say the Democratic Party is a graveyard for social movements. Every 2 or 4 years, the Democratic Party and the liberal media tell us that we have to vote for the Democrat in order to stop the Republican. And it's true that Republican politicians are dangerous for workers. But how many working people end up getting pulled over to the Republican Party or simply don't vote at all because of the Democratic Party?
When we talk to people about, universal health care, higher wages, free college, abortion rights, trans rights, people in Florida support those things. In the year that we elected, I say we, but Florida elected, not me, but Florida elected Ron DeSantis, who's seen as by many as like this ultra far right, one of the most reactionary politicians in the country. Floridians passed some of the most progressive laws in the country. And I would say the reason for that, what a lot of people don't understand, is that the Florida Democratic Party is probably the best example of why the Democratic Party is not the solution and why we cannot look to them to fix any of these problems. And why lesser evilism is just like such a failure. Because the reality is, while Ron DeSantis is passing these trans sports bans and like all these anti-trans legislations, and the Democratic Party saying like, we're for women, we're for LGBTQ rights. Charlie Crist voted against gay marriage. He's on the record as when there was a gay marriage initiative in Florida, he voted against it. And he's now who the Democrats are putting forward as governor. Florida's a really good example of like, we're always told, well, we have to vote for the lesser of two evils. As we keep voting for the lesser of two evils, what eventually happens is the lesser evil that can be put forward is more and more evil.
Workers are sick of the betrayals. We're sick of watching Democrats make hollow speeches and do the bidding of the wealthy. We're sick of watching them take photo ops on picket lines and then vote to block a strike. We're sick of Bernie and AOC and all the so-called progressives who told us they'd fight for Medicare for all, but are now propping up this system that's making us sick. If we're going to win Medicare for all, working people and rank-and-file union members have to get organized independently. We need to get rid of the rotten misleadership. That goes for Democratic Party politicians and also conservative business unionist leaders.
We need a complete overhaul of the healthcare system. Medicare for all would be an enormous step forward. However, it would leave intact the for-profit pharmaceutical corporations, medical device companies, hospital chains, and other corporations. Without the power to control costs, it would run into the limits of balanced budgets and the cutting of services. Workers cannot control what we do not own. Hospitals, clinics, suppliers, labs, and pharmaceutical and medical device companies need to be taken into public ownership by the working class and run democratically in the interest of patients, healthcare workers, and society at large. We also need to understand the nature of capitalism itself. The reason private healthcare kills people is because this system is not a rational system based on human need. It's run by the billionaires in the interests of amassing greater and greater wealth for themselves, no matter the cost to the rest of us. That's why our fight for good healthcare is intimately tied with a struggle against capitalism. So long as capitalism exists, its ruling class will try to take back everything that we win, which they've done even in the countries that have their own public health care.
Everything is connected. That
Right.
is what I'm trying to say. Like it's difficult to just talk about the healthcare when it's so connected to what's happening in the schools and what's happening to society in general, because no issue is isolated from the other. All the issues are connected by the fact that it's the same state, it's the same system that requires these things, that requires cuts, that requires worsening conditions, that requires privatizations, that requires a hunt for increased profits, because this is how the system works.
We need a fundamentally different kind of society, a socialist society run by and for working people, not the billionaires.
The kind of leadership needed to win Medicare for all and the other things we desperately need will not come out of nowhere. Working and young people have to build it through organization. That's why we launched On Strike and Workers Strike Back. Become a part of this movement. On Strike is a production of Workers Strike Back, a nationwide organization fighting on working class demands like a $25 an hour minimum wage, union jobs, Medicare for all, and against discrimination and oppression. Workers Strike Back is also calling for a new party for working people, because neither the Republican Party nor the Democratic Party represents us. Find out more at workersstrikeback.org and donate. And look for us on Patreon to support our work. On Strike is a broadcast entirely for working people and funded entirely by working people. See you next week. Solidarity.